Hi, everyone. I'm Brooke, and my group is here to talk to you about allergic reactions. I had the honor to look up the pathophysiology of allergic reactions, and they are considered an immune response to foreign invaders and affect 15 to 20% of the Western world's population. Understanding the pathophysiology of allergic reactions can assist in the management, treatment, and therefore in the prevention of allergy. T helper 2 cells prime the immune system to view allergens as foreign, therefore igniting an immune response to these invaders. For this response to occur, the body must first be exposed to the allergen in one of the following ways: inhalation into the nose or lungs, through the skin, or ingestion by the GI tract, where it is then absorbed by an antigen presenting cell. From there, the cell moves to a T cell for allergen presentation, which stimulates B cells to produce allergen specific antibodies. The body remembers this primary invasion, and the next exposure to the allergen is what triggers an allergic response. And now Miss Sarah is going to tell us about the signs and symptoms of these allergic reactions.
All right. Hi, y'all. I am going to hit on the signs and symptoms of allergic reactions, as Brooke mentioned. We're going to first connect and review some medical terms that we might need to know for our board exams. Some of these you have heard before, but this reinforcement is not going to hurt. So first we've got pruritus, which would be itching, angioedema, which would be rapid swelling or tissue fluid retention. We've got conjunctivitis, which would be inflammation of the conjunctiva of the eye, urticaria, which would be hives, hypotension, which would be low blood pressure, tachycardia, which would be high pulse rate, dyspnea, which would be labored breathing, rhinitis, which would be inflammation of the mucous membranes of the nose, emesis, which would be vomiting, dysarrhythmias, which would be irregular heartbeat, and then syncope, which would be fainting or loss of consciousness. Symptoms of an allergic reaction can present as localized or systemic. Things that might present as either would include itching, hives, swelling, inflammation of the mucous membranes. The progression of symptoms or the deterioration you might see in your patient could present as symptoms first in the skin, followed by symptoms in the eyes, nose, or GI tract. Further progression would include symptoms that then exhibit signs in the respiratory system. Lastly, cardiovascular signs. Mild moderate allergic reactions may be characterized as a tingling mouth, abdominal pain or vomiting, hives or welts, or swelling of the lips, face, or eyes. Signs of a severe allergic reaction would include gasping, wheezing, labored breathing, a raspy voice or difficulty talking, a continual cough, swelling of the tongue or throat, ongoing lightheadedness, dizziness, and collapse. The appearance of any one of the aforementioned severe reactions suggests anaphylaxis. Anaphylaxis or anaphylactic shock is severe, it's rare, but it is potentially fatal. It causes the blood pressure to drop severely and airways to swell shut. Important things to remember is that while it might be clear that a patient's symptoms are worsening, a patient with anaphylaxis might not exhibit any moderate or mild signs before they proceed into a severe reaction. It's important to know that this would be potentially immediate. Lastly, clinicians should be aware that allergic responses are erratic and are not based on the amount of exposure to or dose received of the allergen. Now we're going to hand it over to Amanda Guzman, and she's going to talk about treatment.
Perfect. Thank you. So once you have, in order to properly treat the reaction, you also want to be able to identify the severity of the reaction. You should evaluate if your patient is breathing and speaking normally and assess their cardiovascular function. If they're experiencing a mild allergic reaction with only localized symptoms, a histamine blocker should be administered orally and the patient should be monitored for any progression of their symptoms. For moderate allergic reactions, 25 to 50 milligrams of a histamine blocker, such as diphenhydramine, should be dispensed parenterally. Oxygen should also be administered at a rate of 4 to 6 liters per minute. In severe allergic reactions, EMS should be contacted and oxygen, as well as an EpiPen should be administered. The recommended dose of epinephrine for adults is between 0.2 to 0.5 milliliters of 1 to 1,000 concentration. EpiPens are an auto-injector of epinephrine that provide a 0.3 milliliter dose of 1 to 1,000 concentration. So if there's not an adequate response to the initial dose, additional doses may be required. Therefore, it is recommended that more than one EpiPen be readily available in case of an anaphylactic emergency. Patients should also be monitored after a severe allergic reaction to be sure that their condition does not reoccur. Now, Adriana will discuss emergency management and office preparation for patients that may be experiencing an allergic reaction.
Okay, guys, I'm gonna go over some protocols that every dental team member needs to be aware of in order to manage an emergency. So the first thing is to assess the problem and recognize and acknowledge the itching, hives, edema, flushed skin if your patient is having the symptoms, and discontinue the treatment and activate the office emergency system. So never leave your patient and call for help and have the oxygen and the emergency drug kit brought to the site of the emergency, and position the patient in a comfortable supine position. Assess their airway and circulation, and assess the patient's breathing and airway, and adjust the head and jaw position accordingly. Then monitor the patient's pulse and blood pressure and provide basic life support as needed. If the patient's condition continue to worsen, contact the EMS and provide the definitive care. As Amanda mentioned, you can use epinephrine to counteract most of the effects of histamine. It produces bronchodilation, raises the blood and the heart rate via its alpha and beta effects, and counters the skin rash, urticaria, and angioedema by an unknown mechanism. These were the protocols that every office team member needs to be aware of in order to manage any emergency for anaphylactic situations. And I hope that you guys enjoyed our group project.
Thank you.
Thank you, guys. Bye.
Thank you. Bye.
I'm gonna leave now.